Your bill was legal. Your denial was legal. The price that doubled overnight, legal. They cited a policy, a regulation, a rule, and they were telling the truth, which is exactly the problem. Because many of the rules that actually shape outcomes, your money, your healthcare, the air you breathe, were never passed as laws, never debated publicly, never voted on. They sit one layer below, in documents that almost nobody reads, written by committees that almost nobody has heard of. Take 2008, the financial crisis. You know the story. Reckless banks, toxic mortgages, greed, all true, and almost all of it was completely legal. So if the laws weren't broken, what actually made the collapse spiral? An accounting rule, called mark-to-market. It required banks to value their assets at whatever the market would pay for them today, not long-term, not at maturity, today. When housing prices dipped, asset values fell on paper. That triggered margin calls. Banks were forced to sell assets to cover them. Selling pushed prices down further. Lower prices triggered more margin calls, which forced more selling. A feedback loop, feeding itself into a global collapse. Not caused by a bad law, caused by an accounting standard, written by an accounting board that almost nobody had ever heard of. Now zoom in, not to markets, to something closer, healthcare. The system looks human. Doctors, patients, decisions made in rooms. But underneath, there is another layer. In the United States, every single medical procedure has a billing code, a 5-digit number, called a CPT code. If something doesn't have a code, insurers won't pay. If the code pays low, doctors stop offering it. If it pays high, that procedure gets overperformed. These codes are maintained by a committee inside the American Medical Association, not elected, not publicly accountable. Their recommendations flow automatically into what doctors get paid across the entire US healthcare system. They don't set prices, they set codes. The prices often follow from the codes. In the UK, the same logic runs through a different gate. A treatment gets approved by NICE, the National Institute for Health and Care Excellence, only if it costs under roughly £20,000 to £30,000 per quality-adjusted life year. Above that threshold, it often doesn't get covered. Same drug, same patient, same diagnosis. One number moves, and the treatment disappears from the system. And then there is the environment. Public debate always focuses on the laws, emissions targets, compliance deadlines, who is inside the limit and who is not. But compliance only ever means one thing: you are within the limit. So who decides what the limit is measured against? What counts as a pollutant? By which methodology? Over what time period? Working groups, in Geneva, in Brussels, meeting without cameras, publishing technical documents in annexes that almost nobody reads. The law says, don't pollute beyond X. The standard helps define what X means. And who set it? A committee that was never elected, in a building you've never seen. Now step back. 3 completely different systems: finance, healthcare, the environment. One hidden layer. Laws tell you what is allowed. Standards decide what those words actually mean. Laws are visible. Standards are invisible. Laws get debated in parliaments and congresses. Standards get written in technical documents that almost nobody reads. Change the law and you start a debate. Change the number inside the law and you change the outcome. Quietly, with no debate at all. I'm not saying the people who write these standards are malicious. Most of them are doing genuinely technical work. But here is what that means for you. Every time you watch a policy debate, you might be watching the wrong layer. Because by the time the law reaches the floor, the number inside it has already been set. Not in a vote, not in a debate, in a technical document. by a committee that you were never told existed. Remember the explanation you were given? It pointed to a law, a policy, a regulation. It was true, but it was pointing at the visible layer. The real answer was one floor below, written by someone you've never heard of, before you ever arrived. So the question I want to leave you with is not, what does the law say? It's this: who decided what those words mean before you ever saw them? If you want to understand the systems that shape your life before they shape you, subscribe.